Welcome to the Posture Pros. I'm Dr. Dan with Dr. Pascal. So a lot of times we see patients coming into our office letting us know that they've got lower back pain. And there could be a lot of different causes for back pain. That's why we want to do a proper exam and sometimes x-rays if necessary to understand the cause. But a lot of times what we're seeing more so in the last few years is sitting and the effects that that could have on the spine, especially causing some tight hips.
Absolutely. So, when it comes to back pain, there can be a specific injury, but there are numerous cases when there is no injury. And what we've found throughout practicing is that oftentimes when someone doesn't have an injury and pain has just come on, slowly over time, or what we would call insidiously, one of the most common factors that most of those people have is they sit all day, right? Oftentimes they have a desk job, and of course they can't, necessarily get a new job, or they might not be able to change that. But then what happens is over time things tighten up more and more, and then they end up with back pain, right? So how can it happen from just simply sitting? How can sitting start to cause someone to have back pain for no reason?
Well, I think the major difference, especially over these last few years, is even working from home. Well, the effect that has on moving that much less. When you think of it, if you're getting ready to go to work, you're getting in your car, you're walking, from the parking lot to work, you have meetings, you're up and down, you're saying hi, you're going to the kitchen to get a coffee. There's a lot of more movement than you think of compared to, let's say, getting up and going to the kitchen and right to the dining room table and sitting down for 8 hours straight. So when we're sitting, we have our knees up, which now shortens what's called the hip flexors in the front part of our spines, which then causes everything to basically kind of get super tight, but it's also creating a huge imbalance. So now we've got really tight front part of the body, and that back part of the body is now, it's almost like a tug of war that's being won from these tight hips. So now there's an unequal pressure, muscles have to be super tight to hold everything together, and the less movement you've got, the more tightness you've got, you're definitely going to start to create more pain.
Absolutely. And those tight hips, what people don't realize is the hip flexor, and you mentioned it, Dr. Dan, the hip flexor is a very unique muscle in that it actually originates from the front of the low back or the lumbar spine. So even though it's a hip mover, it actually starts on the spine. And so as that muscle starts to short and tighten, it'll actually sort of pull on the front of the spine. And obviously the longer it's there pulling, the tighter it gets, the more likely it is to then cause problems to the front of the spine, the front of the discs, and then as you mentioned, of course, the compensations that happen on the back where you almost have like this hyper low back curve or hyper extension, you get compression and pinching in the back. So there's all kinds of things that can happen. It could be muscle pain that happens in the psoas. You can start to get, facet issues in the back where the facets are jamming, and then you can start to get disc issues because you're getting this abnormal or, uneven pressure in the discs, and over time that can cause a disc to herniate, bulge, rupture. So these are all possibilities of back pain simply due to sitting and largely having tight hips or tight psoas muscles.
So today we want to cover basically 5 key things that you can do to help decrease that tightness into the hips and obviously help you feel better and having less lower back pain. So the first thing that we want to talk about and discuss is 30-30, meaning that every 30 minutes you need to move for 30 seconds. So that's something that you could do easily wherever you're working, whether that's at home, at the office, wherever you are, is literally have a timer on your phone, on your watch, on your computer, that it just every 30 minutes, stand up, stretch your body out, walk around, move around the desk, go up and down the hall, up and down the stairs, wherever you need to do, and that will dramatically help you feel better, take out some of that stiffness and soreness away, and help you decrease that lower part of your back pain.
We must sound like broken records, eh?
Yes.
Mentioning 30-30 all the time.
Yes, we do.
It's one of our go-to solutions for everything, and we can't say enough. It makes such a big difference to get up and move. Our bodies were made to move, and just part of getting rid of these issues is stopping that sedentary living, and so breaking it up is really important, okay? So yes, 30-second breaks every 30 minutes. All right, so the second thing that we can do is stretch the hips. So let's start with stretching the front of the hip. We'll talk about doing a deep lunge stretch to address the hip flexor or the psoas muscle. And so to stretch this muscle, what we want to do is get into a nice lunge stance. So you'll bring your front foot forward approximately 3 feet or so. That front knee is bent. And what you're doing is you're lunging or pushing your body forward. And by doing so, I'm going to feel a stretch specifically on that muscle. Now, depending on how tight you are, that might be enough. If you're flexible or more flexible, you might want to increase that stretch, and we can do that by bringing the arms up over the head and leaning back. We get a very nice stretch to the front of that muscle as well. It makes it a little bit more assertive. Okay. With all of these stretches, we want to hold them for approximately 30 seconds, and you can repeat that 2 or 3 times per side, resting as needed in between them. If you want to make it another level of challenging and also address some more of the low back, you can do that deep lunge stretch on the floor, where then you'll drop the back knee down to the ground. You would try and push your hips closer to the floor to really stretch that psoas muscle, dropping your hands and elbows right next to your front foot, and then bringing your torso to the ground. So we're getting the hip flexor, but then you're also addressing the back of the hip on the other side or the opposite side. So a little bit more of a complex movement, but very good for the hips.
And the third exercise we want to talk about is what we call a pigeon. So the pigeon is a fantastic stretch to stretch the back part of the hip, kind of your butt muscles. A lot of times that's a fantastic stretch for people that have really tight kind of glute muscles from sitting all day as well. So basically what we want to do there is we want to bring our knee up. We're lying down, and as we're going to basically come down onto the floor, or if you're doing this also on a bed, and then you're basically able to lean forward. You're going to really stretch the back part of your hamstring into your glute, and as you're going to basically hold down for about 30 seconds and then come back up. And same thing, you want to repeat that, and same thing is you could exhale, which will really help you to kind of get a deeper stretch all the way through to the bottom part. You're going to stretch and hold. Now, if you're having a hard time getting on the floor, you could do this stretch on a bed or a couch, or you could be lying on your back, crossing that leg over top of the opposite knee, and it was called thread the needle. You're going to grab that opposite knee, bring it closer to your chest, and you're going to be stretching the opposite glute muscle.
So the fourth thing that we'd like to address is called active mobility. So we talked about, obviously, number 1, taking breaks. Number 2 was stretch the front of the hip. Those are held stretches. Number 3 was stretching the back of the hip with something like a pigeon. Number 4 is where we want to get motion throughout the hip actively. So we're going to talk about hip circles and hip swings. So these can be done on all fours, but you can also do them standing. And something like a hip circle, you would bring your leg up, right? And what you would do is rotate it outwards, trying to kick all the way back, and you bring it forward. So you're trying to create the biggest circle possible with your hip, trying to get through the full range of motion. So when I do these, I would do 5 to 10 per leg, and then I could repeat 2 to 3 times as needed. So those are the hip circles. The other one that you can do is we tell people to imagine that there'd be a fence, and it's like stepping over the fence and then stepping back over the fence. So you could do over the fence with one leg and repeating that on the other side as well, just trying to lift your leg up high and imagining that you're going up and over a fence, okay? Then we could also do something called swings, where you would just kick your leg forward and backwards with some momentum, trying to get the full distance of your leg swinging forward and backwards, and or side to side, doing some swings in this fashion. These are really good to loosen up the hips and then just try to create full motion and mobility throughout the entire joint.
And the last one we want to talk about is using a ball or a therapy ball to really be able to dig into those really tight muscles. So this is where you would use that ball and either go up onto the side of a wall or a door frame, or you could also do it on the ground, but that would basically be applying pressure and digging into those tight muscles, staying there for about 20 to 30 seconds, relaxing, stepping off of that, and then again digging back in. So it's a great way to decrease the tightness into those muscles, loosen them up, get them moving as best as you possibly can. Okay. So as a quick tip to find your psoas or those hip flexors, basically find belly button and the top part of your hip, right on the front part here, and go right halfway. As you dig in through here, that will be your hip flexor, and that's where you want the center of this ball to be right inside, right on that muscle. That ball should be about 4 inches diameter, so it should be not a tennis ball, not a lacrosse ball, but something bigger that could have a little bit more, like basically surface to really dig into that muscle.
So again, just to recap, today we cover the fact that sitting can cause all kinds of problems in the hips and the low back. Today we really focused on the hip flexor or the psoas muscle, but the 5 solutions to trying to avoid these problems or undo some of the effects of sitting were to number 1, take multiple breaks every 30 minutes, get up and do 30 seconds of one of these stretches, right? Yep. That would be a perfect scenario. Number 2 was to do some deep lunges, stretch the front of the hip flexor. Number 3, doing a pigeon stretch or some stretch to get the back of the hip. Number 4 was to do some active mobility, some swings, and some hip circles. And then number 5, as Dr. Dan just mentioned, is using a ball to really dig into the front of the psoas to try and release some of that muscle tension that has been built up over time. So hopefully those helped, and we will see you next time on the next episode of the Posture Pros. Have a great day.